Cerebral palsy is one of the more common congenital neurological diseases. Since it exists before birth, it interferes with normal brain development. According to the National Institutes of Health, there are 3 types of cerebral palsy, but we'll only be focusing on ataxic cerebral palsy in this video. Ataxic cerebral palsy causes disturbance in one's sense of balance, their coordination, and depth perception. It also leads to hypersensitivity to sensations that would usually be considered normal. Spinning, for instance, causes excessive dizziness. Certain textures cause discomfort in patients, and they also have difficulty differentiating between objects. Occupational therapy is highly recommended for such patients.
In occupational therapy, cerebral palsy patients complete activities that involve spinning, decreasing tactile hypersensitivity, and object discrimination. Having the patient spin will cause their brain to adjust to the increased momentum and a changing gravity. This will cause a nervous response in the bending of the vestibular hair cells and the movement of the endolymph in the semicircular canals. When the patient stops moving, the fluid may keep going, causing dizziness. Tactile sensitivity consists of the patient's discomfort when they interact with certain surfaces, such as fur or brick. Having the patient consistently interact with different surfaces will optimistically reduce hypersensitivity and discomfort and introduce familiarity.
Systems being targeted are the vestibular and proprioception systems. For a child with vestibular and proprioception imbalances, such as children with cerebral palsy, loss of balance and discomfort when touching certain objects are very prevalent. The first activity stimulates the vestibular system by allowing the child to pinpoint and focus on a certain point or object to obtain balance. The second activity allows the child to understand and develop a correct sense of how much pressure is used for movement and lessen the hypersensitivity in touching of certain objects.
As far as long-term effects go, the spinning technique will help stimulate and develop their vestibular and proprioception senses, which will improve their balance, locomotion, and perception of depth. A long-term effect of the texture-feeling activity is it will enable the child to develop his tactile senses and decrease hypersensitivity to normal stimuli.
Such activities can lead to improvement of the child's sensorimotor integration abilities, which will then enable the child to better interpret sensory input and ultimately develop more appropriate motor responses.